This is John Boquette with the Newtown Bee, and we are back here on Friday the 13th with First Selectman Dan Rosenthal and Newtown Health District Director Donna Culbert for the next in our series of COVID-19 clips. So Dan, starting with you, a lot is happening and much of it involves your coordination of public building and community facility adjustments and closures. Let's cover what people need to know.
Sure. So, by now I'm sure people have heard that the superintendent made the difficult decision to close schools. And that means, again, we're following through with the social distancing process. That's why that was done. That was done to mitigate the spread of illness. As such, we've worked with all of our public facilities, community center, library, Edmond Town Hall. We've worked with some of the non-public ones, NYA, the Everwonder Museum, to make sure that they, scale back programming, because we don't want to take 7 school buildings and empty them into the communities. People should be into the community. People should be staying home. Kids shouldn't be having play dates. We shouldn't be going to the movie, on trips to the city. This is meant to have people isolate themselves some and mitigate the spread of this illness.
Certainly it's temporary, of course, but Donna, you also, I know, have some important information because while we on the information delivery end may be getting burned out, certainly the general public has to be getting burned out as well on things like message and news cycle fatigue.
Yeah, I've talked to lots and lots of folks here in the community. I know that people are anxious, rightfully so, particularly with those that are vulnerable in the community, may have underlying health conditions, and not knowing. And that 24/7 news cycle can be a little intimidating and frightening. I want to reassure folks that there are steps that they can take to protect themselves and to protect their loved ones, and we'll share all the information that we can with them as we get it. But I'll continue to tell people the importance of hand washing, disinfecting common surfaces frequently, staying home when you're sick. That will be the drumbeat for a while, because that's really what's going to hopefully flatten that curve that we talk about as far as illness in the community is concerned. But we'll continue to do that. I'm thinking that as people do that more and more, it's going to become more of a habit, but I'm not going to stop saying it. And somehow I like to try to reassure folks that we have great members of our community here who are working hard to do the right thing and help each other, and we'll get through this. But I really have been quite reassured in all of the conversations, and I think people are doing the right thing and making sure that they reach out if they need any support in the process.
And to reiterate, you are not only in touch with a wide range of colleagues in the public health departments, not just in the region, but across the state, but you are in, or could be in, constant communication, or at least have constant contact with the Connecticut Department of Health, the CDC, and even the WHO.
Absolutely. Constant flow of information. And I guess I'll also just add, one of the things, there's a lot of anxiety about people worrying about a case, whether we have a case. Like right now we don't have any cases in Newtown. We could conceivably have some that we don't know about, not tested, not confirmed. Likely someone who has mild illness is hopefully staying home. Somehow I just kind of want to reassure folks that it's, as long as we're doing the right thing, we'll be okay. But it's important that people stay home. I don't want people to be so hung up on the case idea. The most important thing is people are accessing the healthcare that they need, if they need healthcare outside of their home.
Very good. And Dan, in closing, although you've conveyed how you'd like people to try to isolate, closure challenges do bring a lot of concerns, and I know that you have some about local small businesses.
Yeah, actually, and another thing I'd also like to add, that the closure of school, again, the social isolation of all this is going to fall particularly hard on many of our working families, some of our senior community. So I do want to convey to folks that if they have particular needs, they should be reaching out to our Human Services Department for help. I mean, we remain ready to help people and do whatever we can to to sort of help them with whatever their issues are. I also want to remind folks that this is also falling particularly hard on our business community, our restaurants, our retailers. So while we don't want people out congregating, there are ways that you can still support local business via restaurants, via takeout. You can call businesses ahead of time and try to arrange to pick up a product in advance so that you're not in stores hanging out. But we should be conscious of our businesses and try to support them as best we can while, again, not congregating, but supporting them nonetheless.
And at which time the municipality creates some sort of a central clearinghouse for information, which I understood might be coming down the pike.
Yeah.
We want to make sure that folks know that they can go to newtownb.com, they can go to the Newtown Bee's Facebook page, Twitter page, or YouTube site for updates and information. We are working closely with the community to make sure that we're mirroring information and trying to keep the message consistent. We really appreciate all the great work that everyone in the community, all the employees and auxiliary organizations are doing to try to protect the community, especially the folks that are right here at the table. I'm John Boquette for Newtown Bee, and this is the next in our series of COVID-19 clips. We will be back with another one early next week.